Gives me great pleasure to be amidst you all here today. Uh, I am very happy, and I speak for the whole of the government that APEC Med this year, after a long stint of holding sessions elsewhere, has chosen India as the venue, and I welcome you all. From my part in India, I've already had a day's deliberations, and I understand they were productive. I'm also told that there is a very good turnout. So again, cause for happiness from our part. And I hope that this is a beginning of a stronger and deeper relationship of EPECMED and all its members with India. Uh, it's today's session here now, and I'll also be joining the CEO's roundtable thereafter, post-lunch. So that will give us a lot of time to understand uh, all of you who have come all this way to really, what is it that makes sense for India and what is it that makes sense for the world. As our Prime Minister keeps saying that make in India and make for the world. And now increasingly in the department, we are also saying, yes, also innovate in India and innovate for the world. So what we have, the vision is really that India connects very well to the world's needs and the world connects to India. India has a lot to offer to the world, uh, and it has a lot to offer not only in terms of a market. To put things very simply, uh, uh, today maybe India is contributing, say, a few percentage points to, 2.5% or something like that to the global demand. But as India's economy grows, as the health requirements here grow, as rapid expansion continues to happen through one of the world's largest and fastest growing public health insurance programs, the demand and the ability to secure healthcare and health provision is going to grow up exponentially. The medical technology sector in India has already experienced double-digit growth for the last 1.5 decades, and there is every indication that this will continue not for a few more years, but for decades to come. And what's really driving this whole thing is really the fact that India is home to 1/6 of the world population. Every sixth human being on the planet is has India as her or his home. And this reality is not going to change into the national vision milestone of 2047 when India would complete 100 years, and which is what all policies in India are currently geared towards. And as that happens, as India goes on from being the fourth largest economy to, as everybody expects it to be, and certainly India does, third largest and onward, purchasing powers, and as India progresses to the vision of Viksit Bharat, that's a developed India from a developing India, purchasing power in India will also equal its proportion. So you're going to move to a situation where in demand terms, India will grow from 2 to 3% now to 17% by 2047. That's the long-term sustained demand driver, which is a given almost because it's driven by economic forces and demographic forces, which have a long-term impetus and momentum. The question, of course, is as this happens on the supply side, on the investment side, on the value chain side, value footprint side, how much of it also moves to India? The second thing I would like all of you to take back with you as a thought is that India as a country, as a civilizational ethos across millennia, a point that we've very strongly made during the Indian G20 presidency, has had this belief of Vasudhaiv Kutumbakam, the whole world is one family. We share one earth, one family, one future. And it is a country which is deeply committed as a civilization. It is ingrained that we seek to live and exist, coexist with everybody and be in a shared manner. This is not a country which is given to sharp polarizations and divisions. We like to exist as a country, as a people, with everybody. So therefore, India is a very trusted and reliable partner to have in anything which is a value chain or a supply chain footprint. And that is how the country would like to position itself. It is a country which has dealings with every other country on the globe, and we expect that to continue. We are committed to that. and that ensures a lot of de-risking, a lot of resilience. So as demand is totally given, and as this kind of connect with the wider world is also a given, and we have policies which are which are aimed at positioning India well for this whole ecosystem and medical technologies and medical devices to grow sustainably. Uh, as to the CEOs and the business leaders present today, my message would be: look very seriously at India and look at it differently than a regional market. What we are looking at is all parts of the value chain. The world, of course, has known India best in the pharma medtech space as by that moniker of pharmacy of the world, which is the formulations thing. There, of course, we are in the off-patented space. We are the acknowledged leaders in the world. But we are moving in other ways. We are moving, we have solid plans to move in other ways and other areas. We've had the the production-linked incentive scheme for medical devices, and we've got a large number of products, some 55 products already out there, which have come into being, and those include high-end products, as I need not tell this audience, but everything ranging from linear accelerators to MRI machines to CT scans to mammograms, heart valves, and so on and so forth. They are already being produced in India. We are also looking at deepening the ability in the ecosystem to produce critical raw materials and critical components which are needed to deepen the value footprint within India, which will help it make more business sense to really locate production within India. I mean, that means medical grade alloys, medical grade glasses, medical grade ceramics, medical grade polymers, medical grade packaging material, and so on and so forth. For infrastructure, we have three upcoming medical device parks. We, of course, have the Andhra MedTech Zone, which was a state initiative and a wonderful one at that. And on similar lines, we have at a very advanced stage 3 more, and they are all expected to be functional sometime by early 2027. And that will give us a good space where common facilities and would to begin with be created. And in the next version of the scheme for that, we are planning to build more specialized facilities of the kind that I mentioned, that medical grade materials locally available. So that will give us a scale and common facilities there. In addition to creating common infrastructure and supporting production through the PLI scheme, the Production Linked Incentive Scheme, we are focusing in a very big way now on innovation in India. So we have a scheme which was announced some time ago, but we hope to launch that scheme within this month, actually, with a call for proposals for it's a scheme in Indian rupees 4,200 crore, and that's called the Promotion of Research and Innovation in Pharma MedTech Sector, or PRIP as we call it. This scheme will cover equally pharma and medtech, and it would have both early stage and late stage funding support in ticket sizes that go all the way up to 100 crore rupees. We'll be supporting to the extent of 35 or 50% of the cost, depending upon the nature of the proposal in the late stage, and in early stage, 100% or 50% of the cost from this. And it will cover the entire, the journey of technical innovation, all the technology readiness level ladders from right up from 1 to 9. We would not only be giving it support in terms of money, we intend to help shepherd the ecosystem through a very well-structured digital platform and hand-holding for the same. So innovation is very much also on the top of our minds. We have, aside from the Department of Pharmaceuticals, which I represent and head, and whose mandate is to promote pharmaceuticals and medtech industry in the country, we have key partners elsewhere. Some of you would have probably interacted by now in the sessions yesterday or in parallel today. Some wonderful work is being done, and some very unique work is being done by some of our partners. In particular, I would like to mention the Indian Council of Medical Research, and they have two initiatives which are, I believe, fairly unique across the globe, called MedTech Mitra, which simply means MedTech friend, and Patent Mitra, which is patent friend, where it is offering support in kind as a service of complete end-to-end journey in handholding in every manner, both pursuing MedTech innovation and also for pursuing, conceiving of, filing and maintaining patents for innovative things. So as a service, every day at an average of more than one a day since its launch in 2023, today the number is, I believe, more than 400 on their website. Uh, every medtech innovation which comes into India is being supported as that, with that. The innovation space in India is also growing rapidly. The Department for Promotion of Industries and Internal Trade, DPIIT, in the Ministry of Commerce and Industry, they champion the startup system overall in the country, and they register all such startups. The numbers of life sciences side startups in the country in 2020 at the time of COVID were less than 1,000. Today it is more than 10,000. It's a universe which is growing rapidly. It is also a universe and a fact, a less well-known fact, that whereas the world recognizes India today as the third largest innovator in ecosystem and technology they take it to mean information communication technology in the sense IT is spoken of in India, pharmaceuticals and medical devices are equally a tech sector. However, because of the longer approval processes and costs involved, successful innovations that have already happened and come out of India and reached the marketplace have not happened under Indian labels, so therefore it is not very well known that successful innovation is already being done in India and reaching the market. We intend to make that very visible and to hasten the process through all the initiatives that we are doing. I make this point that primarily for you to take with you that India is not just a market with a certain scale or a regional market, but it has every potential, as the theme for today's session is, to really emerge as a global medtech hub and a leader in the space. And I would like to think of you and start evaluating India accordingly and factor it in your business plans. Finally, and I look forward to this interaction that will happen now with the panelists, but finally, let me also say, as a department, as the secretary of the department of the government in charge of promoting this entire industry, our doors are always open to you, to all ideas, every help, every suggestion, and please take every opportunity to take the benefit of that. We'll value your inputs. Thank you.
Thank you to the Honorable Chair, and with that we begin the panel discussion.
Thank you, Shri Amit Agarwal ji, for setting the tone for this discussion. I couldn't have asked for a better set of panelists here for this interaction, because the question is not a trivial one. We are all aware that this is an industry which is going to boom and grow and thrive in India. Even if we let it be, this industry will double in next 5 to 7 years, triple in next 10 to 12 years, and so on and so forth. But the question here is slightly different. The question is, what can really help India become a much more meaningful global player in this ecosystem and become a medtech hub for the world? Now, we are not trying to compare it to being a pharmacy of the world or so on. Let's keep those encumbrances aside. But that's the question that we are trying to answer. And as we get into that question, the first question that comes to my mind is, what does it even mean to be a medtech hub? What is a good aspiration to have that the entire industry, the ecosystem could aspire towards? And maybe if I could start with you, Feng Dong, to share your view, a little bit outside in what would you believe could be a good aspiration for the country?
Thank you for the opportunity. First, introduce myself. My name is Feng Dong. I'm working for Medtronic as an Asia leader. Really appreciate this opportunity to speak on these opportunities. Before we talk about this, let's give you an update for Medtronic. You know, we are running business in India very successfully in the last many years. You know, they contribute really double-digit growth. So very convincing. So we see a lot of innovation come to Indian market. We also made a lot of investment. You know, we have the largest R&D center outside the US. We set up in India. We have thousands of employees working here. So definitely Indian market is very convincing from the growth perspective. And back to your questions, you know, how we make India as the global hub for the MedTech. So I like to speak on how we built up this ecosystem, right? I'm not Indian, but I travel India very often and I know Indian market. So I like to see it's happening, right? Happening. I think that's the direction. It's very good news for the patient in India and also good news for the Asia patient as well. So look at this, how we make it happen. I think first we need to continue to be innovative, right? How we make the innovation happen in India. That's why we believe we have such a strong talent pool here. So we put the investment on the R&D center here. So we believe they will produce the new idea not only for India, also for global. So we see a very positive outcome already. On the part of this, we also partnership with all the healthcare stakeholders, hospital, government, together to continue to focus on market development and physician training, education programs to continue to build up this skill set. Another experience I also want to share is how we continue to generate the evidence, the clinical study. That's some plan we do have. So for India, I think it's very good news for India. We need the Indian data, right? But looking at something what we out of our works, like how we make the regulatory, we can influence, but we're happy to partnership, make the regulation relatively easier, and also we still need to keep the quality and control the highest standard in the world. And then we look at the other stuff like supply, that's and also another areas. I think India is really grow very fast in the almost every single industry. It's very convincing. And then the government set up the tone for future. I think by 2047, we believe that will be 50 billion market. I think that's very, very convincing, very exciting message for all of us, right? I think it's definitely very good news for Indian patient, right? Thank you.
Thank you. Maybe Himanshu, I want to come to you next, and Sujay, then I want to come to you after that. Himanshu, Feng Dong spoke about innovation in India for India, but also for the world. Yeah. What do you think could be the other elements that could be important parts of India being a medtech hub for the world?
See, I think we have already initiated a lot of things in last 5 years, I would say. Post-COVID, the whole industry has changed, from being just 1,000 companies manufacturing in India. Today, we have almost 3,000 to 4,000 companies manufacturing medical devices in India. So a big change. If you see, that's a 3 times, 4 times growth in manufacturing industry. Yeah. Imports will continue to come down, I think, and that's already happening. Exports continue to rise, and I think as time progresses, I think that China plus one, I think, is playing out well. Of course, India has not got the first advantage there. I think Vietnam or Thailand or Malaysia have taken that first advantage. But I think now it's coming to India. And I think that's a big move, because now I've met people across various industries where are going to global markets, which was not happening earlier. Today, most of our, let's say, consumables, a lot of our, home care products are being exported globally, and that industry is growing. Apart from that, we have seen now, medical equipments also growing from India. And as we see next 3-4 years, that will also become a big industry in India, because the whole electronics ecosystem has started in India. Yeah. And that's a big one, because we were completely dependent on parts and components from outside. But with that electronic ecosystem starting, I think that is a big advantage is coming in. Then look at, Sir talked about medical device parks. I think that's a big initiative government has taken through PLI, medical wide parks. Then you talk about PRI scheme, then, assistance for, making parts and components in India. So I think government has done its bit, I think. And now it's for the industry to scale up and invest. And I think today there's no dearth of investment. Today, you see in MedTech, capital is flowing very freely, which was not the case 5 years ago. I've been in the industry for 28 years now, running a medical device company. For first 25 years, I think I was devoid of capital. But now I see capital is flowing, the other way around. So it's a huge input which is coming in, which was, because in MedTech, there's a long gestation period. When you set up something, you need a lot of time to, incubate the products, get regulatory approvals and go to Indian and global markets.
Yeah.
It could take maybe 4 to 5 years actually, typically for a product. In some cases, when they are critical devices, it could take even maybe 6, 7 years. So I think we have now reached that stage where a lot of investment has been done. Regulatory framework is very, very solid, I would say. Today, we export to 125 countries. So at least Indian regulatory system is so robust that at least whatever we are following, we are able to, follow that for global markets also.
Yeah.
So that's also a very big plus point to make India as a, global medtech hub. Then you look at, and I think I'd see India not a market for 1.4 billion people. India is a market for 4 billion people. Because look at the whole global south.
Yeah.
That's the opportunity in front of us, whole of African market, whole of Middle East, South America, Southeast Asia. We can cater to all these markets. Yeah. And I think with our software power, now hardware industry also growing very rapidly in the country, IT support, for equipments, and when you look at raw material, I think supply chain is getting easier now. I think, and I think with this GST reduction and all that, it will also impact manufacturing, where costs will come down for certain products and materials to manufacture in the country. So everything will push the demand. Also, with whatever we have seen so far in last so many, we have standards for medical devices now. 1,600 new standards have been put in place. So I think a lot of work has been done in last many years to push India as a global hub. I think we are not that far. I think what I see today, by 2035 at least, India would be the top 5 medical devices industries in the world in next 10 years. Because that's you've seen the electronic industry. If companies like Dixon say we're going to triple in 2 years or 2.5 years, you can see how the electronic industry is moving now. Today, a lot of these medtech products are electronic based, even home care, larger products, equipments. So it will benefit all across actually. So that is what I think, and that's my estimation.
And amen to your aspiration. With that, Sujay, I want to come to you. You bring a very different perspective and vantage point here. If you've looked at the global medtech evolution and now you're seeing it in Asia and India, what would be your perspective, both in terms of what would a good aspiration look like and what could be some of the things that will enable us to get there?
Yeah, thank you. Thank you. So first of all, I just want to say it's a real pleasure to be here with all of you and in this room, and congratulations to the APAC Med team for creating this fantastic forum. For me, I would say, for India to be a true global medtech hub, I mean, let's create that vision of what that would look like. Three things come to mind. First is India isn't just a large market, but it's a place where products get designed, manufactured, and scaled for the world. Much like what Ireland did in Europe and China has done in Asia and in some ways as well. Second is it becomes a global hub for innovation. And with innovation, I don't mean just breakthrough innovation, but it's also frugal innovation that that you can solve for the access and affordability as well, because these are some of those innovations that you can also take globally, and they can travel globally to other developing countries, which will also benefit India in that sense. The third thing for me revolves around talent and capability. So India, should be a global capability center where digital expertise, clinical expertise, engineering expertise converge. The good thing is that a lot of these building blocks are already set in motion. I mean, you have a strong government focus in this sector. You have manufacturing technology parks. You have digital infrastructure and a large STEM pipeline here in India as well. So if you combine all of this with consistent quality standards and you layer it with a global regulatory alignment as well, I mean, I think India definitely can be a very relevant player on the global stage, and I think the aspiration should be nothing short of leadership.
Thank you. I'm getting a lot of nuggets and buzzwords here from India as a market, not for 1.4 billion, but 4 billion to frugal innovation. Varun, I now want to come to you, and it's a very different perspective that you bring to the table. Um, End of the day, no market without its domestic consumption can flourish and grow. Um, what is your view on how the domestic consumption is evolving, and how could this become a stepping stone for India as it becomes a globally relevant hub?
So thank you, Anirudh. First of all, a bit of introduction. My name is Varun Khanna. I run a company called Quality Care Limited. We're a new company. We run about 5,000 beds currently. And we've also announced a potential merger with Aster, which collectively puts us in the top 3 healthcare providers in this country, in excess of about 10,000 beds. So first of all, thanks for inviting a customer. Yeah, I know. This room seems to be largely people from the MedTech world. So while I'm saying thanks for inviting a customer, but as they say, for any industry, you should know what the consumer wants. So let the consumer speak first and not last. So I just wanted to bring in some degree of humor so that I can catch your attention. So they still had me here, but the last one talking. You know, I have done a little bit of medical technology and devices in my life. I used to run Becton Dickinson many moons back in India as the country general manager. You know, I've seen this industry evolving into 3 strategies. The first one is we are a distribution market. India is a distribution market, and we'll have a distributor appointed. You could have direct or indirect distributors, but that's it. The second phase, I think, started for the industry, and the good phase started for the industry about 10 years back. When the industry and some leaders like Himanshu from the Indian tech side, I heard Medtronic investing in India and many others have invested in India. The strategy was invest to penetrate in India. And I think the future is for where I see the third part of the strategy evolving. Invest to penetrate and export, right? And unless someone's moving up this chain, it is unlikely that you will be relevant 10 years from now, is the way I see this industry evolving. So I think the first thing each one of us has to do in the medical technology space or the device space, to figure out strategically if the goal is to invest to penetrate in India and export from India. Otherwise, you know, you'll have scale challenges, et cetera, et cetera. Now, just to add, or try and answer the question that you asked me, let me give you a little bit of what's happening on the consumer side of it. Because while I think from a supply side of it, you've spoken a lot, on the consumer side of it, a lot's evolving. India today, when you look at the healthcare delivery system, I don't know how many of you are aware, India has added or doubled its bed capacity in the last 7 years. Right? And when you talk of India doubling bed capacity, those are serious numbers. Those kind of numbers don't get added in the entire of Europe. I don't know how many of you know, and I'm going to do a show of hands. How many of you can answer this question? How many beds will get added in India in the next 7 years? Anyone? All right, all right, take a guess. 34,000 we'll add this year. Maybe this quarter. Yeah, maybe this quarter, not even this year. 1 million beds are getting added in the next 7 years. And I'm serious about it, by the way. I don't know how many of you have really done your budgets like that, because the budgets essentially, the way I know MedTech, is done that, okay, we are able to get to double-digit growth, as was spoken about. But if you look at it from what the industry, the delivery side is doing, those numbers will amaze you. 1 million beds. Tell me which part of the world has got to add 1 million beds. And to make your life simpler, because some of you operate not in the hinterland of India, but in the top tier cities of India, the top 20 providers, only the top 20 providers have announced 100,000 beds in the next 3 years in this country. And it's for real because almost 7,000 of those beds I am building myself, right? So that's the level of capacity that's getting built in. Another piece that is changing, this capacity is no longer getting built into the tier 1 cities of this country. It's done, right? I don't know if you monitor something called the bed ratios per 1,000 people, but I'll give you a sense of those numbers. India stacks at about 1 bed to 1,000 people. Global averages would be 4 to 5 beds to 1,000 people. US will be 12 to 13 beds to 1,000 people. We'll never get there, and we don't need to, I guess. Uh, there are cities today in India, for instance, Hyderabad. Hyderabad has 2 beds to 1,000 people. Does it need more capacity? The answer to that is no. So where is capacity coming in? Because talent's available, and by the way, healthcare has a lot to thank the education system in India. Today we are able to do what we are able to do is because we have availability of talent available. Doctors are available in this country across the board. We add 150,000 specialists every year. And Anish Bafna, sitting in the audience, and myself have known the Indonesian market. Many of you must have known the Indonesian market. That country adds 300 specialists a year. And it's got 1/4 the population of India. So that's how blessed we are. 150,000 specialists per year are getting into India, and which is taking delivery systems closer to the patient. You'll all agree that nobody wants to travel for healthcare. Everybody wants healthcare in a 5-kilometer radius to where they stay. Anybody wants to travel? If great healthcare is available closer to home, the answer is no. Now that's happening. I can tell you, for those of you who've known the Bombay market, 20 years back, anything from Maharashtra will go to Bombay. 10 years back, anything from Maharashtra will go to Pune and Bombay. Today, anything around Aurangabad stays in Aurangabad, anything around Kolhapur stays in Kolhapur, anything around Sangli stays in Sangli. And Nasik has become a reverse feeder. Pune goes to Nasik. You'll be surprised, right? Because it is cheaper. And why is this happening? And by the way, the complexity of work that is handled today in Tier 1 cities is the same that is handled in Tier 3 cities. Any guesses? How many cities in India do a kidney transplant? All right, that's your consumer talking, so you better figure out what your consumer wants. 100 cities in India today do a kidney transplant. 100 cities. And I got my dad's kidney transplant done in '94, and that time India had 5 cities doing a kidney transplant. So that evolution is something that we need to track, and I think that's where the consumption patterns. Last piece of advice that I think I'll leave you from a market standpoint. I think a lot of Indian, I won't say Indian companies, a lot of multinational Indian companies that have actually set up base in India and have taken this market seriously are actually growing double of the distribution markets. Today, I don't know how many of you know, Himanshu is not really tom-tommed about himself, and it's my job to tom-tom about him because I'm his shareholder, right? When he talks of double-digit growth, he's talking about 20% growth, if not 25, and I'm talking about CAGR, right? His company is one of the fastest growing medical technology industries in the companies in India. And what has he done? And by the way, only 30% of his volume comes from India, and 70% of his volume is abroad, right? He's actually spread out thin, understood the consumer, developed a consumer connect that's unparalleled, right? And that's the strategy to work in India. So I'll leave you at that. Thank you so much for being a good audience.
By the way, there is some fun in having the show of mirror in the end. So thank you for the consumer perspective towards the end. With that note, I want to change gears a little bit and talk about what can we really learn from other regions which have gone through this journey, whether it is in Ireland, so you were speaking about, or a Norway or a China. Maybe Feng Dong, if I could start with you. And give us a few examples or nuggets of learnings that could be relevant for us at the juncture we are at.
Okay, happy to take this question. Medtronic, 75 years ago, we established this the first pacemaker for the world, and start this industry for MedTech. Right now, we see multiple hubs, right, in the worldwide. So we see Galway, in Ireland, mainly for cardiovascular products, for manufacturing side, plus some R&D. And also for pacemaker, definitely Minneapolis is the one. And for us, for Abbott and some other companies, we are doing this EP products. And also for orthopedic side, we see Washa in the US. And also we see the surgical like Denver in US, and also several others. A lot of example, because that's happening in Europe And the US, they established this a long time ago, right? Maybe not fully relevant for Indian story. But I like to pick up the case in China. China has similar population. You know, China and India are the largest population for patient perspective as well. They definitely have strong needs. One of the learning is, I think the government definitely take the leadership role to trigger this happen. So, on the back of the story in China, they carve out some special trading zone and set up this zone in the nearby Shanghai areas, and they try to attract investment on this. Actually, that's only you look at it from the industry perspective, right? So for manufacturing, for R&D, that's the government, they set up well. They gave a very, very nice policy, right? So which is happening in India. We see they are really welcoming as well. But another part for from the local market developer perspective, I think they also do tremendous work. So they continue to increase the investment on healthcare, and also they even pushing to train more doctors, right? To make sure the capability, the skill set is there. And at the same time, they also very active to call the investment, right? For industry, for venture capital investment. So all of the investment come to this area, eventually make that happen. One learning part I actually just refer to Indian is the local market development, right? So I think that part, we still see some opportunities to continue to grow Indian market, right? We see maybe 6-7 years ago, we start to have a reimbursement, right? To try to address the issue for affordability, which is very, very good news, very, very good start, very convincing. So I hope we continue these efforts. Think about this imagination. Hard to believe in the future, India is the largest hub for the world, but the Indian patient cannot enjoy that. That's a very self-conflicting, right? I think the first, we need to make sure Indian patient will enjoy this effort, enjoy this journey, right? Before we expand to globe. We see the efforts Indian government is doing excellent job, really focus on these areas. We see the growth, we see the number of the patient was treated by even the most innovative therapies. It really is happening. So we are very confident on that. Another part is the ecosystem setup, right? So India is different from China. Seems they are more state-based, right? China is more centralized. That part, I think everything has a challenge or a benefit. But I like to see if you a little bit consolidate and the balance the first spread out would be help to consolidate on resources on the one areas and to encourage. We enjoy the partnership with the Hyderabad government partnership, right? So they also gave a lot of the welcome setup for us. So allow us really to put all the resources in one place, eventually can make our work get a good progress. And another part for training, education, for the therapy awareness, for the therapy penetration, that's another crucial, because we want to benefit all of the patient, every single patient in India, not only this patient living in the large city, right? So that's take time, and also they take quite a bit of journey for that. This happened in China as well, right? They start with Beijing, Shanghai, reimbursement happened. Now they have a call. They say, every patient, they shouldn't go leave your province or city to get treatment, because they want the fair treatment for every single patient. So, but we have a lot of learning on this. I think in summary, the whole ecosystem build up is so crucial. Thank you.
Thank you. And maybe, Sujay, if I can invite you to share a little bit of learnings and ideas and suggestions yourself.
Yeah, I mean, I think Feng Dong covered quite a few important points there. I think what I would say or add to is, one big lesson, I guess, from China is the fact that is the value of having a long-term policy consistency. I mean, you look at what China has achieved in the last 15 years. They've gone from a low single-digit market share or percentage of the global MedTech market to 10%. And they've done that on the back of a clear industrial strategy and investment. You take some of the other mature MedTech hubs outside the US, like Ireland and Norway, et cetera. I think an important lesson there is the fact that you need to have a stable business and regulatory environment. And I mean, I think I would also, I mean, I think it's important to say this. I think no MedTech company, in fact, no company is going to invest in high-end manufacturing in countries where the rules are not predictable or globally aligned in that sense. So it's important that you know, India strives for that as well. I think there's another learning perhaps from these other MedTech hubs is the emphasis on quality and compliance. So without having those world-class standards, you know, these exports are just not going to be able to scale. So I think you know, those would be some of the key learnings. I also think perhaps one other thing to mention is, you know, creating those clusters and partnerships between governments, industries, and even academic institutions. It's really important, I think, to be able to create those innovation ecosystems that will allow, you know, the industry in general and the segment to thrive in the future.
Thank you. There are a few themes I've picked up across the two of you, right? So there is this whole emphasis on access and healthcare, the expenditure around it, the growth of clusters, ecosystems within the country can't be just a few cities and so on. And we see a lot of this happening in India, right? At least one of the McKinsey research we looked at, it said 49 clusters in India today are driving 85% of healthcare consumption, to the point, Varun, you were making earlier. And with the Jan Aushadhi and so on now, like a stent placement and all is all covered in Jan Aushadhi now, right? So these are things that are starting to happen in the country and happening at scale. But if I now come back to you, Himanshu, and then I'll come to you, Varun. If you were to take a bit of a skeptic view of what will really help us accelerate this journey further, of course, there are endowments, so please do talk about the endowments that we have, but also tell us what would you like to see more or do more yourself to be going after this opportunity in a systematic manner.
See, I think the first point here is innovation. I think Indian companies have to innovate. And I think we have talked about frugal innovation. I think we are not going to survive the world with frugal innovation. We need to bring in real cutting edge technology and innovation. And I think few companies have already started doing it in India. And now it is coming step by step. So I think initial learning was that, yes, we should make products, you know, which are already available in the market. And, you know, like in pharma today, there are off-patent drugs. So we have off-patent devices which we can manufacture. And I think the scale is coming now. As we see, you know, we'll see next few years, as these medical device parks, you know, 3 more parks. And they're not 3 parks. I think there are maybe another 4 or 5 coming at the state level also. Kerala is a park, Maharashtra is coming with a park, Gujarat is there, Rajasthan is there. So a lot of other states are coming with parks. There's also one park in Andhra Pradesh, for example, and of course, Telangana. So the ecosystem is coming already. Now, what we probably see is lack of raw materials and components. Probably that is what is the industry I would like to see grow very quickly. Because today, as a company, I have 330 vendors outside India for different raw materials, parts, and components, which are not available in India. So I have to rely very heavily on them. So gradually that ecosystem keeps on moving. So like every year, if we can even move 10-15% of our import to Indian-based suppliers, I think that ecosystem will keep on, going up the value chain. So I think that's one. Second is this industry academia collaboration. I think, and I call it like not call it AI, but industry and academia collaboration, and that is what we should talk about here, because there is somewhere industry is there, academia is also doing very well, but there is no collaboration today. I think we need industry's participation in the academia. I think I want to flip the other way around. Not academia participating in industry, but industry should participate with academia. And I think that is missing in India today. I think we say that, well, there is no collaboration available. But what is industry doing? Nothing. So I think we need to move that needle a little bit more from the industry side, so that we get more. There's cutting edge research happening. We just had a meeting with, let's say, one of the IITs a few days ago, and there was so much happening in those IITs we didn't even know. And this was right next door. Like 5 kilometers from my office, that IIT is there, and I don't know what they are doing. So it is industry's loss that we are not able to, capture that innovation and research which is available in the country. And even partnering with, DRDOs of the world, which have cutting edge research and technology and material technology, which we are importing today. Why don't we even find a way to collaborate with those kind of institutions? So that's another area. Then I think when we look at the other things which we can work on, I think India's regulations are pretty well up there, but I think we need to go notch above that. And what I'm trying to say that, can India be part of MD-SAP program, for example, so that our regulatory standards are seen by global companies as at a global level, so that India's regulatory standards are up there in that whole framework. And then can India be part of a full member of IMDRF, for example, rather than being an associate member? So anything which is happening at the global regulatory level, we are first to know. We are not last to know. So we can catch up quickly rather than going at a very slow pace there. So I think that's another area. So that today, as we don't have a lab in India, ESCA lab. So even Indian labs, the data coming from Indian labs is not seen at as a tangible data, or let's say creditable data. We still have to go to US labs to get our products tested. So I think Sir is already working on that. I think one of these medical device parks will have a ESCA lab. So I think those things which are the small things which are missing, and these are small needles to move. I think the bigger needles we've already moved in India in the last 4 or 5 years. 5 years ago, nobody knew MedTech industry in the country. Today, everybody is talking about MedTech. Even all your pharmaceutical companies that want to get into MedTech space, you know it very well. And even today, look at automobile companies. They want to get in MedTech. So it is going across cross industries. So I think we have already shown that this industry has a huge capability across various streams. People are already thinking that yes, there is a cross pluralization of technologies, and they can flow, in different directions. So I think a lot is happening, I would say.
Maybe Varun, if I can come to you.
Yeah, sure. So quick ones. I think there's a lot to celebrate to start with. Right, there's a lot's gone well. You got capacity expansion happening. You got double-digit growth happening. Sir spoke about the PLI from the government. That's happening. There's enough capital chasing the sector. I won't be surprised if this year you end up with $2 billion coming from private equity into Indian healthcare, MedTech startups, and scaled-up companies. And most importantly, over the last 2 decades, we've been able to keep the healthcare inflation in check. So if you look at the healthcare inflation, it's about 3 to 4%, which is lower than the inflationary pressures that we've had, and delivering a high double-digit kind of a growth rate. There are a couple of things. I think one he's touched upon, but I'll still state it my way. India has taught frugality in healthcare to the world. But can we say the same about quality? Maybe not, right? And therefore, the clinical validation infrastructure, which is one reason. So I'm not saying Indian healthcare quality is bad. It's not bad. But we need to prove it. And therefore, the clinical validation infrastructure coming into place will give us the pride of proving to the world quality with frugality. And I think that is an important lever for India. And the second piece is, I think Sir also spoke about, the government is talking about it. There's reimbursement that is coming in to create access, right? But is it good enough to support quality and adoption of global best practices? Maybe not. So I think as a country, we need to look at both. We need to look at access and the depth of reimbursement. I think those are the two improvement areas, so to say. I'm sure will continue to evolve.
Maybe just a quick follow-on question, Varun, for you here. I want to bring back the other AI, as Himanshu was saying, the artificial intelligence and the machine learning and so on. Do you believe any of that can help us leapfrog some of the challenges that you spoke about, or resolve them faster, better?
Okay, at the risk of not being quoted ever again. AI certainly is a buzzword, and I don't think India has really caught up to AI currently. I know the government is taking a lot of initiatives on AI. The way I see AI today, US has developed a lot of AI. I think commendable work that has happened, but that is more to create more capital.
Yeah.
I think China has done some stunning job creating DeepSeek, etc., etc. Yeah. To me, that is coming in a way to say they want control. So one wants capitalism, the other wants control. And I'm not saying India is there yet, nowhere close. But India has a very distinct and a unique opportunity to liberalize AI. And that distinct opportunity, I think if India starts doing the right things around healthcare AI, would really be a game changer. I do hope some of you sitting here are working on those from an India perspective, because I've seen a lot of companies who've invested in India, created frugality into their products, have been able to globalize those products at significant margins. So if some of you could look at that space, again, a lot of work to be done. But if 2030 is one way to review ourselves on AI in healthcare, liberalizing the whole thing, moving away from the capital and the control that I just spoke about, I think we'll redefine the world in many ways.
Thank you. And I know we are also towards the end of our session. Just a quick recap. We started off talking about frugal innovation. We spoke about access. Then we also spoke about the manufacturing capabilities that the country has built. We also spoke about how it is important to balance innovation, quality, and cost. All the three, the trifecta, if I may. We also spoke about the um, turbocharged growth we are seeing in the domestic consumption, whether it is just the healthcare infrastructure getting set up, or it is the quality of care going up, and where it is happening, right? The point around 100 cities where kidney transplant happens is an amazing fact to keep in mind at the back of our heads. And we also spoke about some of the very pertinent learnings we can draw from China, from Norway, from Ireland, where it is not just about the infrastructure, the spend, and the industry, but also um, policy and regulatory, which is truly a global standard, which integrates well with the global network, and so on and so forth. So those are some of the takeaways, and there were a lot of buzzwords, as I said earlier, right? There was frugal innovation, there was India, not just a country of 1.4 billion, but an opportunity of 4 billion, and so on and so forth. So those are some of the big takeaways that I took away. I wanted to just pause here and come back to Shri Amit Agarwalji and request you, sir, what are your observations? And as you reflect on the conversation that happened on the panel and just now, what would be your few takeaways and some of the imperatives that you want the room to take away?
So yeah, thanks to all my co-panelists for adding richness to the discussion and with the this is I think the points have all been made and they've also been summed up. What I would like to say that yes, all of those as far as the government's policy canvas are concerned are very much on our agenda also. And we recognize all of those things. We are working on many things. I did mention some of those. I did not mention several others. There are some very interesting things we are doing, and I take totally that point about liberalizing AI. We are doing some very interesting things, and I do believe unique things in the offing down on that theme of liberalizing and at the same time achieving scale for AI. So in fact, this afternoon, we have a very interesting thing which we've been working on now for 8-9 months. I would not mention the details, but those of you who are familiar with it, with the jargon, there's something called DEPA that India has been talking about in line with our approach of, digital public infrastructure. And we are looking for something like that to hasten and enable discovery. The other advantage in AI that this country has is again the population and the way the domestic industry has grown. Some of our, when you do digital X-rays and interpret them on the spot, and you're growing at such a fast pace in large numbers of hospitals and large volumes, data is the fuel which drives AI learning. And as more devices and networks and markets get linked up, India has a natural advantage in trying to train data to more accurately predict things, to automate things, and so on. So that's at the user end of things. The other AI that Himanshu talked about academia and industry, we have under our department, just like everybody's heard across the globe, I believe by now, the Indian Institutes of Technology. We have 7 national institutes of pharmaceutical education and research, which are similarly structured. And we've recently taken a policy decision and constituted a committee under my chairmanship with all the industry associations and all the NIPERs to really deeply institutionalize the. I have actually inverted it and we flipped it and said not academia industry connect, but industry academia connect, and precisely the theme that Himanshu spoke of, which is that get industry as not as a passive recipient of academia, but as a co-creator of the academic agenda. So NIPERs we are positioning as vehicles for industry partnered HR, continuing education, industrial training, research, and be very deeply application and industry oriented in every which manner. And we have a whole menu of things how we propose to go there. So yes, that is very much on the agenda. The regulatory aspect, which our health ministry looks at, again, it's their brief, but yes, they are doing many things in the works, which, if I may sum up as a bottom line statement to a business audience, well, on the one hand, raise the standards and the way things are dealt with, at the same time, reduce the time taken to do it, which is what China did in a sense, and that's the bottom line that they're working towards. They've engaged a strategy consulting firm, they've engaged Kaizen for business processes, and we are doing some fundamental rethink jointly with them on how to structure the organization to have the capacities to really be able to do it, to open up the system to really co-opt capacities beyond the government system so that we have better capacities. So many such thoughts in those directions we are working on. Organizational change is a deeper thing. It takes time, but when it comes, the things I'm talking about, they will have a lasting impact the way we've done in other things. So those are on our agenda, and it was really wonderful listening to all those buzzwords and thoughts. And yes, many of those were very useful thoughts for me as well. Thank you.
Thank you. Thank you so much. Um, as I said, I couldn't have asked for a better set of panelists here. We did not just unpack a tough problem, but it was all about actions. I really loved the way all the panelists talked about the different actions they are taking, plan to take, and they would like to see being taken. So thank you. Thank you so much. With that, we'll wrap up this session and hand over back to the.
Yeah, thank you to all the panelists for really action-oriented discussion. Thank you. We'll close with a group photograph of